All right, so I got this question the other day. Dr. Charlie, is this weird? When I sneeze or when I cough, my back hurts worse and or I get some shot or jolt down the leg. So is that weird? Does it make sense? What's going on there? And so I wanted to answer that in this video. I'm trying to figure out how to sneeze for this video. How would you sneeze? Can you do it? Do it. Do it. No, do it. If you try to make me sneeze, I'm going to try to make you sneeze. Go sneeze.
No.
Sneeze.
Achoo!
Achoo! Pretty unnatural sneeze, fake sneeze, by the way, but I did my best. Try to make yourself sneeze. It doesn't go too well. Either way, real quick, my name is Dr. Charlie Johnson. I'm a physical therapist. I help people all around the world with unresolved back, butt, and sciatica problems. That's my specialty. Learn to fix themselves using the power of the mind and movement as medicine. What does it mean if you sneeze and or you cough and it increases your back pain and or sciatica? So sneezing and coughing replicates something we call a Valsalva maneuver, which is basically where you're kind of holding your breath and or straining, and it increases pressure within the abdomen. That says abdomen, and increases pressure within the disc. So again, it doesn't necessarily mean this with 100% certainty because it's just one piece of evidence, if you will, or one clue. But if your back pain and leg pain increases when you cough or when you sneeze, or maybe that caused you to throw out your back, some people have that problem, then is most consistent with a disc problem, because we know that coughing or sneezing increases abdominal and intradiscal pressure within the disc pressures. All right. Now, that being said, one sign of a disc problem. So we want to look at the big clinical picture now. So how else, besides sneezing or coughing, if you think it's a disc problem, Charlie, how else maybe could I tell? Well, you could download my DIY diagnostic guide. That would tell you probably. Or we could just go through it here. So sneeze, cough, if that increases pain, that is one sign of a disc issue. Another thing would be that if you have central lower back pain, it says central lower back pain, pain kind of along the level of your belt line. If you have pain or trouble with transition, so going from a sit to a stand position, maybe you have difficulty after you've been sitting for a while straightening up, and you have to be careful about how you stand up, and it feels like you're bent over, like you're 80 or something like that for, first 5 or 10 steps, and then once you get up, you're a little bit better. Bending or lifting is worse. Standing, walking, little caveat to this, not always better. Sometimes disc problems can actually cause more pain when you're standing and walking. You might feel better when you're sitting, but the majority of people will generally say, as a clinical pattern here, that if they have a confirmed disc issue, that standing and walking feels somewhat better versus, say, bending, lifting, or sitting and driving. But again, it's not a definite there. And then another thing would be that if you have sciatica. So the number one cause of sciatica is a disc problem, all right? So again, real short video here. If you have pain in your back that goes down your leg and or just an increase in back pain when you cough or you sneeze, it indicates that you may have a disc problem because it increases pressure within the abdomen suddenly, and it increases pressure within the disc. That sign alone does not necessarily mean that you have a disc problem. So, as outlined sort of in the DIY diagnostic guide, there are some different sort of things or signs or symptoms that would also be consistent with a disc problem. So when you pair increased pain with sneezing or coughing with these other things, the chance of you having a disc problem appears to be much higher, all right? Central lower back pain, pain that goes across the belt line, a lot of stiffness or pain there. Trouble transitioning, trouble straightening up. You've got to be bent over for a while when you walk. Oftentimes there's increased pain in the morning. Disc pressure is highest in the morning. So I didn't put that in there, but I'll add it now. Bending, lifting, sitting, driving, things that put yourself in this position are generally worse. Standing and walking is generally better, but there is a case where you can have a disc problem that actually causes more pain when you stand and when you walk. You actually might get complete relief or feel much better when you bend forward. So don't be tricked by that. So just know it could be a little bit interchangeable there. And the number one cause of disc problems, or the number one cause of sciatica, pain, numbness, tingling going down the leg, is a disc. So if you've got like all of these things and sneezing and coughing is also a problem, then you can be fairly certain that a disc issue is the cause or the source of your back, butt, or leg symptoms. Now, a little maybe tactical tip. So what do I do about it? Well, you maybe can't predict sneezing and or coughing. Maybe coughing is a little bit more predictable, but let's just say you're sick or, I don't know, you've got some allergies or something like that. Sneeze comes out of nowhere. So just recognize again that, this goes back to an old study, a Knockamson study, not that you have to remember that, but in 1970, it sticks in my brain because it's a really interesting name, where they did where they looked at different postures and they looked at the effect of those postures on pressure within the disc of the spine. What they found, right, is that sitting forward like this had a higher disc pressure than, say, standing up and being neutral. All right, and so you want to be mindful of this idea of being bent forward when you sneeze. So if you're going to sneeze and you notice and you have a split second, most of us when we sneeze, we go, achoo, right? And we round our back. Maybe, we're sitting as it happens, so then we're even more round, and we tend to kind of have this forward bend moment while we're sneezing. Who sneezes and bends backwards? I've never seen it happen, all right? So now I think about it, interesting. Don't know why that happens. That would be weird, right? Imagine somebody sneezes every time they went backwards, right? Like they're drinking something. Either way, you might be able to brace yourself. So whether you squeeze your belly, right, and just kind of like brace your belly so this way you don't go forward and you're aware of that, and or maybe you plant your feet or spread your feet and you get in a slightly backwards arch position and you sneeze like that and you brace, all right? It's maybe something to think about. Look, I don't have any evidence that that is valuable in the sense of it's going to protect your back or make it not hurt. But what I would be doing as somebody who's scientific and be testing things, I'd be saying, hey, if I'm coughing a lot or if I'm sneezing a lot and every time it kills my back, then right now my body wants to go into this forward bend moment. That's really yucky. And it wants to increase the disc pressure because we're sneezing or coughing, rapidly increasing the pressure within the abdomen and that disc area. And when I'm in this forward flex position, it actually increases pressure within the spine compared to like a neutral upright position. So could you stand up and could you tighten your belly? Let's see if bracing it and preventing movement while you sneeze helps. It's probably pretty hard, but let's see. All right, maybe it's not possible. I don't know. I'll try it and let you know. All right, let me know in the comments what happens. All right, and or could it be that we get in a slightly extended position, maybe put one foot in front of the other when we sneeze, and let's see what happens there. And or could we twist to the right and sneeze, or could we twist to the left and sneeze? Could we side bend to the right and sneeze? Could we side bend to the left and sneeze? All right, so just some things to think about. And so what I did is I just said, okay, the body can move a couple different ways. We always want to sneeze forward. So sneeze, right? And it's in this forward direction. But we can move our spine backwards. We can move it to the right, side bend to the left, and we can twist to the right, and we can twist to the left. So I'd be testing each and every one of these. All right, so this, if you're watching this video, hurts. Choo, achoo, whatever, okay? Try replicating a sneeze. It's like really weird. But you could try being slightly backwards. We'll add another test here. You could try just staying neutral. So maybe this is just braced. Brace. And you try that neutral one, that's test number 1. Then you try the backwards. So you sneeze while you're bent backwards. That's test number 2. Then you sneeze when you are bent to the right. Test 3. Bent to the left, test 4. Twisted to the right, test 5. Twisted to the left, test 6. Now, hopefully, maybe you're one of those people who sneezes like 6 times in a row. Maybe you're not, but coughing might be easier to test this, so I don't recommend that you do this on purpose to test it, but just when things come up, recognize that you have some different ways you might be able to sneeze and or move your body position. So is it the sneeze, or is it the body position we put ourselves in when we sneeze that causes the back pain? I don't know, just a thought, okay? So hopefully this was useful and gives you some ideas if sneezing and or coughing is the problem. What could it be? Most consistent with probably a problem within the disc, but we can never be 100% certain. In isolation, sneezing and coughing and an increase in back pain doesn't necessarily mean a whole lot of anything. But when you add it to the whole list of things that I had earlier on there, then probably increases the probability of disc problem. If you're still not sure, you can download DIY Diagnostic Guide, essentially my algorithm for figuring out what could be going on. I lay out everything in my brain inside of that. You can grab your free copy. And then also, like, what do I do about it? So if sneezing, coughing is a problem, then start sneezing and coughing in different positions. Use kind of these cardinal directions, if you will. Forwards, yucky. Backwards, right, left, twist right, twist left, and neutral, braced, to see same, better, worse. You might also be able to grab a pillow or something like that. Here's the thing, if you're coughing, you might have it. Sneezing is probably going to come up pretty randomly. So maybe you grab a pillow and you can like hug it close to your belly and or your chest, and a lot of times that will brace. This is often a technique used for people after they have heart surgery and they need to cough, sneeze, and like do things like that to kind of brace to prevent any type of impact on the surgery and things like that, okay? So that being said, hopefully this is useful. Let me know your thoughts in the comment. What happens? Was it valuable? Hit the like button as well as subscribe. Hit the bell for notifications when I post new content every single week. Thanks so much. I'm just going to sit here until I sneeze. Tickle my nose.
Sniff a little dust or something.
Sniff some dust. Get the heck out of here.
Like a feather. Here, come here.
The stuff you do for these videos. It's just weird.